actually need stem cells whatsoever, embryonic stem cells, that we may be able to actually use the endogenous stem cells in our body to be able to affect spinal cord repair. Do you see that as a real possibility within the next 20 years?
I think it's a real possibility. The point would be that in order to be able to trigger our own stem cells, we have to understand what makes stem cells work. And I don't think we can study that without having stem cells to study.
Yeah.
So it's almost a circular argument. We need to have the human embryonic stem cells.
Human embryonic stem cells in order for us to discover the programs to make them into neurons and glia.
Exactly.
That's the bottom line.
Yep.
Okay.
I just was... One of the things that came out of being here is finding other TM patients, which hasn't been easy for me from Syracuse. So I've learned, I seem to be the only person who didn't have an acute type of onset, not hospitalized, and I'm grateful for that, I guess. But I get concerned because you're doing all these statistics, and I don't want you to lose people like me, because there must be others who, using that expression, fall through the cracks, but there is no hospitalization record for me. There are just individual tests as symptoms showed themselves. So I'm just wondering, is there some way to include me in the numbers like me in your research? Thank you.
So, go ahead.
Well, you just happened to have mentioned previously that you have a recurrent form, is that right? I mean, so I hope you never have an attack again, but if you do have an attack and they do draw off some cerebrospinal fluid, I think one of the most important things that is hard to understand outside of science is how critical it is to have people who are willing to communicate with our center, or with your doctors, have them communicate with our center, because we have all sorts of ideas that come up as to, we think this may be causing this illness. And if we can't actually go to a repository which has a list of patients who are willing, like you are, to participate and actually say, for this person who had a recurrent TM, I think I know what the marker is. Well, I'm only going to be able to show that if I can go and get CSF from a series of recurrent patients who have recurrent TM. So being able to have that, and maybe you could just...
I mean, we do see patients who, and I suppose when you say acute, you mean completely paralyzed in the hospital. No, there are cases, and 1/3 of the patients, not 1/3, percentage of the patients are mild TM, at least in terms of, they're mild in terms of motor function, but they may have a lot of sensory deficit. So we do see patients like you. Yeah.
I think you're right in terms of getting lost in the numbers, because Sandy just quoted some numbers that in the United States there's probably 30,000 to 40,000 patients with TM, roughly, and you guys have studied approximately 1,100, right? So that's only 1/40th of the actual population that could be studied. So you can see that there's a lot of data from people just like yourself that's just falling through the cracks or being misdiagnosed. So this is one community with rare diseases that we really need patient participation in order for us to be able to give the answers that are going to ultimately cure you guys.
Go ahead.
I was talking to somebody at lunch today who said she can't handle heat very well. And I wake up most mornings in a little lake. I don't know what's happened to my thermostat, but menopause.
Menopause. There is a menopause too. There is.
Just kidding. I'm just wondering how. When I exercise, I sweat much more profusely than I ever did. How do you deal with? Is that common, and how do you deal with it?
Everyone looking down here. I'm the pediatric neurologist. I think is your whole body, this is getting a little personal, but is your whole body sweaty? It's not just, related to where the lesion was.
My neck down.
Yeah.
Move to Syracuse.
It's hard to answer that. I think, there are other things that can cause that to happen, and thyroid dysfunction is one of them. Thyroid was checked. It can be related to anxiety, especially with early morning awakenings.
Withdrawal from opiates can cause.
Aha. So it's hard to answer that one, and it's hard to know if it's related to your TM, although it sounds like you never had it before, and since the TM now you're having it. So, and again, it's the end of one study. It's one individual. What does it mean? We really don't know. But do you have further suggestions?
Well, I just want to point out, and the men in the audience can back me up here. Us guys, as we do get older, we notice some things are not working as well as they used to. And one of the things I've actually noticed is that my temperature regulation as I'm getting older seems to be changing. So, and I don't know if that's well documented in men or not. I mean, we all know about women, but I certainly have noticed it in myself. I used to be able to stand anything, and I used to always be hot-blooded, and now I'm getting colder much more easily. So I don't know if that could also be the natural part of getting older in men. Yes?
My thermostat certainly got affected by TM. I can do exactly the opposite of it. I get chilled very easily. I need an extra blanket at night, whereas before TM, the day before it, it was totally different.
Cold all the time.
So it could very well be related to the disease itself, and certainly somebody could.
For people with paralysis caused by the TM, below the lesion, it makes sense that you would have coldness and temperature dysregulation. But for those of you who it's including parts of your body above the lesion, it's a lot harder to explain. There is a disease called Hodgkin's disease that sometimes causes night sweats, and I don't want to alarm anyone, but I would say a thorough medical exam. Dr. Thal, since you're the expert here in family medicine, do you have any other thoughts?
Actually, I've heard this complaint from some of my MS patients, and I haven't had a clue, but I think there's something there, and I smell a study. I think we need to listen to our patients, that even though it doesn't make scientific sense, we clearly just in the last 5 minutes have heard true confessions here, so there's something going on which could be that, men aging, but I doubt it. It just seems a little too
Coincidental.
I just wanted to add to that. When I take steroids, which is for flare-ups, I sweat exactly like that.